Hi, everyone, and welcome to another segment of Safe Space. I am Mariela Salgado, and I am here with Jessica Drake. She's our social determinants of health manager, and she's going to guide us on what to do to access low cost care. So, thank you for being here, Jessica.
Thank you for having me. I'm excited.
So, I kind of want to ask a few questions. I know since the pandemic, there's been a lot of people that are unemployed and they're still looking for affordable healthcare services. So, how can we help?
So, there's a couple of different things we can do to help you. So, first is signing up for our eligibility services. So, you can go to our website and hit Become Our Patient. You would fill that out just as you would for any of our services. And you would click on eligibility services, and then our call center will give you a call and you can schedule that appointment. And so we can do that two different ways. You can come into our office and have that, or you can do it virtually. So when it comes to eligibility, we offer a lot of different programs that you may not know about. So our first one is our sliding scale program. And so that is for any and everyone. It's all based off of income. So with that, it applies to our medical, dental, and behavioral health services. You can use it for an entire year, and then you just have to get recertified. And so we also offer Healthy Texas Women, Title V, and we also help with the Medicaid application. So if you are needing to apply for that, you can actually come to our office directly and apply for Medicaid.
Okay. So, if I'm a single mom and I'm kind of looking for care for my children as well, what do I do?
And so, what you would need to bring to this appointment, you need your any type of ID, any government ID, whether that's a driver's license or just a government ID with your a picture on it, and then you would need your check stub. So if you aren't working, we could use unemployment benefits. We can use Social Security. We can also use a financial letter of support. So this is a notarized letter, basically from anyone who is supporting you. So it has to have a dollar amount on it, and then it's notarized, stating that you are receiving support from someone, so that you can make it throughout each month. And then if you do have dependents under the age of 18, you just need either their social security card, a birth certificate, or if the child does have insurance, we could use any of those to show that you do have dependents living with you and that you're taken care of. And so all of these factors go into that sliding scale, yes, as a whole. And so that'll also help too with Medicaid applications and the other programs we offer too.
Okay. And this would be, that letter would be, for example, a lot of people lost their homes during the pandemic because of unemployment.
Mm-hmm.
So that would help with that.
Yes. So pretty much it, like I said, it just states that that person you are living with is helping you out financially.
Okay. So how does the Greater Gulf Coast Community Network help during all of this?
So the Greater Gulf Coast Community Network, I know it's a mouthful, but it is something we partner with United Way to provide this service. It's a referral network that we use in our clinics. So it pretty much is, so you come for a visit and our eligibility staff or our care coordinators can see and understand your needs outside of your medical appointment. So if you're needing any assistance with housing or rent assistance or utilities assistance, or if you have any food insecurities or transportation needs, we can refer you through this network. So this way, instead of most of the time, they just give you the information and you just have to do what you will with it, whether that's if you actually follow up with them or if you decide, I'm just going to hold off. This way, through this network, it pretty much does it for you. So we send your information over to that organization, whether it be United Way, the Salvation Army, and there's many, many more that are a part of this network. And
okay, so that kind of helps because I think that you're in a state of I need help, and you would rather have someone reach out to you instead of going and looking for these services. So it would help quite a bit.
Yes, it would, because people can get very overwhelmed. And so, especially if they're needing, a couple of different services that they're in need of help for, this does it all for you, and you're not having to worry about, taking the time to call and, potentially being on hold or, things like that. That organization that we send your information to reaches out to you directly and schedules whatever you need.
Okay, and all of this, your eligibility specialist guides you through it, right?
Mm-hmm. Yes, yeah, they will guide you through it, and so will the care coordinators. So if you are seeing one of our care coordinators, they actually will follow up with you and see if your needs have been met and things like that as well.
Okay, that's great. If you have any questions for Jessica, you can drop it on the comment box, or you can send us an email to wecare@mychn.org, and Jessica will be able to help you. Thank you for being here, Jessica.
Thank you for having me.
And now we have our counselor, one of our favorites, Veronica Cavazos. She'll be joining us here right now. So we all know unemployment can be a lot of emotional turmoil, and Veronica's going to help us.
I'm here to help with emotional turmoil. Yes, I am. As a therapist, working throughout this pandemic, I have seen how COVID has impacted the lives of so many, individual people like myself and, families that have come in for help and assistance, for themselves and also for, their children making the transition, back to school or continuing with online education. So this pandemic has hit us in so many different ways, but one of the ways that it's really taken its toll and its impact is with unemployment and, the loss of jobs and the unexpectedness of it all. The first thing I want to say is that if you haven't filed for unemployment, please do so. Get on the internet, get on the Texas Workforce website and apply for that unemployment. There are most likely still delays because of the influx of people that are applying, but do not put it off. Continue to get on there and apply. I was lucky enough to speak to someone who actually works in contract with Texas Workforce and takes phone calls of people who are calling for information or things that are going on. And I just wanted to share some of those little tidbits that I got from this person, because I thought that would be very helpful in discussing unemployment and the struggles that we go through. What she told me was that because of the influx and processing the proof of identity and who you are and going through all those steps, it does take about 6 to 8 weeks. However, this does depend on the county that you work in. The other thing that I thought was really, really important that she shared was she said, make sure to check your mail. Make sure to open those envelopes that Texas Workforce sends you and go through that information. A lot of times your benefits can depend on what is in those envelopes, what is in that information. Now, I always share a little bit about myself when I do my safe spaces, and I'd like to say that I myself have been on unemployment in the past. I was in grad school, lost my job, and I was lucky enough to receive unemployment. And they do send you a lot of information in the mail.
It can be overwhelming.
It very much is.
It can be.
Very much is overwhelming. But as this individual I spoke to said, it's important that we go through that paperwork. A lot of times some information may get lost, may not have been sent out or filled out correctly. And that paperwork is an opportunity for you to make that correction so that your information can continue to get processed without being denied. Make sure you have all of the requested information, go through that paperwork, go through the requirements, and make sure that you have checked all the boxes of the required information. If you were self-employed, this was something that I did not know, and I was really, really happy to hear. She said that if you were self-employed before the pandemic and then lost your business because of the pandemic, you can now apply for unemployment. So that was another really good tidbit that I was surprised to hear, and I definitely, wanted to share. So make sure that you're filing, you're appealing if necessary, and you're checking all the boxes of required information, because those are things that can be so very helpful.
Another thing I actually learned from one of our coworkers is that, the winter storm, So many homes were ruined, and FEMA was actually, it's still paying for hotels.
Oh, really?
Yes.
Awesome. Yes, reach out to FEMA. Their websites are very easy to navigate. Some of you may have received FEMA emergency packets in the mail way before this winter storm. I know I was getting stuff in the mail regarding FEMA. If you have that, dig it up, pull it up. If not, get in, find the 800 number for FEMA online and reach out to them. Help is still available. Help is most definitely still available. We're always accepting new clients, and like you talked about with eligibility services and the easy way to become a patient on our website, sign up with us and come talk to us. We have a variety of counselors here to work with you and to help you through all of this. Unemployment is a difficult time, and it takes a toll not only on your depression, but on your anxiety of what now? What am I going to do now? I've talked to many people who have struggled with losing their jobs and how are they going to support themselves or their families. And I break it down and I say, sometimes we can't always get back to where we were. When we slide down a little bit, we have to, make our way back up. And sometimes that means taking a job we wouldn't normally want to take. Like I said, I lost my job in grad school, and I was lucky enough to get an unemployment, and it helped me for a period of time. But then I had to go back. I had to get back in, and I had to take a job that financially it wasn't the best, but it was something I needed. It was something that helped to keep me afloat, my head, my shoulders, above water a little bit. On the way here, on my drive here this morning, I saw 4 places that had signs on their marquees that said, currently hiring all positions, inquire within. Don't pass these places up. And I encourage that of all of my patients that come in that are talking about how they're struggling with their depression or their anxiety because of losing their job. Sometimes we have to take the job we're not 100% wanting, but it's something to keep us afloat, to get us to the next step, to get us to where, we want to be in the future. You never know. That career, that business could be what takes you to where you wanted to be, but couldn't get to with the last job. Don't pass up opportunities. There are options, there are opportunities out there, but don't pass them up just because it's not for me. It's for everybody. How do we know unless we give it a try?
You're right. So everyone, thank you for joining another segment of Safe Space. If you have any questions, you want to access some of our services or any of our services, please call us at 281-824-1480 or chat with us on our website, www.mychn.org. And thank you for watching, and stay tuned for another segment of Safe Space. Thank you for being here, Veronica.
Always a pleasure to be here. So much fun. Bye, everyone.
Bye-bye, everyone.